So, as a rule, patients don't come in and tell me that I want Botox in my chin or in my forehead, or I want a specific filler in my nasolabial folds. They're really generally confused about what to use where, because they've seen so much in the printed media and magazines and TV and whatnot. And so my job is to explain what the different fillers and agents do in the different areas. So for example, with Botox, Botox inactivates muscles that cause lines. So those are the lines of motion. Botox is FDA approved to be used between the brows, and as an extension, we also use it for the crow's feet. We'll use it sparingly for some of the lines of the lip, and in many people who have dimpled chins, we'll use it there. Occasionally, when you have severe banding in the neck, we'll put a little bit of Botox in the banding to quiet the banding down, and sometimes that's the only treatment for that. When I look at fillers, there's a whole bevy of fillers. Some are hyaluronics, some are Radiesse, there's Sculptra, there's many different kinds. Some are used as a volumizer, as a fat substitute. Others are used very superficially to fill in lines and wrinkles. And so you sort of have to decide, what are we treating? For example, in the mid-face, when we see hollowing under the eyes and we see some shadowing there, we'll use a combination of hyaluronics under the eyes, such as Restylane, and then we'll use Sculptra, or the patient's own fat, to volumize the cheek area. A new development is to use Voluma in the cheekbone area, and simply that's a hyaluronic which has approval for use in that area and does a very, very nice job of augmenting that area. When I think about this area in the corners of the mouth and the nasolabial folds, those are probably the most commonly asked areas, and there often we have a loss of deep structure, which is the fat from years of smiling and laughing and making facial expression. You'll actually lose some of the deep fat, and those folds get very deep. But in addition, often there's a wear spot in the skin and there's a crease in the skin, and if you just fill the deep fold, you'll still see that crease line. So in that case, we will use Radiesse deep, and we will use Juvederm superficially in the crease. You really have to specifically look at the different areas and look at the palette of different injectables that we have, and you have to specifically pick what's appropriate, not only for what the patient's needs are, but what's appropriate for the anatomic area that we're treating, because we're not going to use Radiesse in someone's lips. We're not going to, there are certain do's and don'ts of all this, and it's really important that when you're seeking someone, that they have the expertise to sort of know when and where and how to use all the different bevy of products that are available.